about 10 years ago, in several centers, it was found that high-frequency oscillations, so HFOs, can be found in the brain. And first this was found in, especially in animals, with microelectrodes, but soon it was found out that you can also record them with macroelectrodes, so normal, regularly used invasive electrodes in the brain, and that you can record them in patients, people with epilepsy, and that the area that shows high-frequency oscillations may be pretty informative about really where the epileptogenic tissue can be found. And so this was found first, and then we always thought that it would be impossible to find these events non-invasively, because there is this way of thinking that small signals can't be found outside of the brain, because and there's one thing that's actually in the textbook saying that the skull is kind of a filter for the signal, so you can't see the signal outside. Well, we found out that's not true, because actually with EEG, but also with MEG, which is magnetoencephalography, you can find these little vibrations that you can find inside of the brain. You can also find on the outside. They're less strong because you're further away, but it's not true that it's impossible to find them. So, and then the challenge is to improve your recording and your signal analysis in that way, that you can find them the best you can. If you compare it to all the signals people try to catch from space, I mean, it's just a matter of improving the way you record to find tiny signals. And then if you can find them non-invasively, you can also better use them, for instance, in the diagnosis, for evaluation of treatment, etc.